Hello everyone, thank you for joining my channel. This is Michael Sabat. We come with a little bit of an update for the COVID-19 coronavirus pandemic that's going on right now. So looks like the U.S. has hit 1,000 deaths. It's a milestone here for us as the global death toll passes about 20,000. I'll read a little bit here on NBC News. So what's going on with that? The United States has reached a grim milestone as the number of deaths linked to the coronavirus has passed 1,000 in the country on Thursday, according to a count by NBC News. The number of reported deaths associated with the disease in the U.S. was at least 1,001 as of Thursday morning, according to that count, and there have been more than 68,000 reported cases. Globally, reported deaths passed about 21,000 according to Johns Hopkins University. The university put the U.S. death toll even higher than the NBC News count, which is listing it at 1,050 as of 2:30 a.m. Eastern Time. Deaths continue to rise in New York, which has been called the epicenter of the epidemic in the U.S., and there had been at least 334 deaths linked to the illness caused by the novel coronavirus as of early Thursday, and they count all the deaths in the United States. New York has been hit the hardest. I have a lot of friends that work in New York. I used to work in New York City, and some of them been telling me how tough it is out there. They're having some good days, the a little calmer days, but there definitely have been some tough days for them recently. So, but they pull through. Some of the strongest nurses I know are in New York City, and I'm praying for you guys every day. Now, this all comes in the background with other things that's happening right now. In New York, there's been a surge and near capacity in the morgues. Political reports: New York City morgues near capacity. DHS briefing warns, and that's not good because where are they going to put all these dead bodies? Officials were told that morgues in the city are expected to reach near capacity next week per the briefing. Let's read a little bit. The Department of Homeland Security has been briefed that New York City's morgues are nearing capacity, according to the department official and a second person familiar with the situation. So there has been corroborated by two people at least. Officials were told that morgues in the city are expected to reach capacity next week per the briefing. A third person familiar with the situation in New York said some of the city's hospital morgues hit capacity in the past 7 days. So there's been a little issue there. Some of them are saying it's going to hit it next week. Some of them are going to saying it's already been hit. Whatever the case may be, death toll is rising, and the medical system is strained, and the morgue capacity is getting hit. If you remember recently in Spain, they hit in Barcelona or Madrid, I forgot where it was, but they're using an ice rink to store dead bodies as a makeshift morgue. That's how tough it is over there, and many are saying that New York and possibly other states are going to be facing the same issue. And FEMA spokesperson told Politico that New York has asked for emergency mortuary assistance. Hawaii and North Carolina have asked for mortuary help as well, and the Disaster Response Agency is currently reviewing the request, according to the spokesperson. And even with this background, there's an even kind of a grimmer background that's going on right now. There's an ethical fight that's going on within all the hospitals across the United States. This is happening as hospitals across the United States consider a universal do not resuscitate orders for coronavirus patients. For those who do not know what a do not resuscitate orders are, it's pretty much clear on the phrase do not resuscitate, meaning that if you ever go in a code or if your heart stops or stop breathing, they will not resuscitate you. And a lot of times these are end of life measures or people who have suffered so much, and the physicians and the administrators have talked to the family and given them that option, and a lot of times the family have they they make that decision by themselves. However, a universal do not resuscitate order is a totally different ball game. This is basically saying that you're not gonna well, I don't know, you're not gonna consult, but you're not gonna be taking the family's decision into account. Let's read a little bit. Hospitals on the front lines of the pandemic are engaged in a heated private debate over a calculation few have ever encountered in their lifetimes. How to weigh the save-at-all-costs approach to resuscitating a dying patient against the real danger of exposing doctors and nurses to the contagion of the virus. Now, here's the crux here. We as medical professionals are trained, and we're bound by oath to make sure we do not do any harm, and also we're bound by oath to make sure we save as much as we can. However, at what cost are we going to be able to do that? If a doctor or a nurse gets hit by coronavirus, they take it home with them, and they get everybody else sick, their kids start taking the coronavirus to the grandparents, or if the doctors and nurses start dying of the coronavirus, at what point are we going to say, well, that one life is worth the others? I'm not saying that we should do this, but this is an ethical question that has to be weighed by ethicists at this point. And it's good that we're talking about this now, because when the time comes and we will be overwhelmed, and it's not just if, but there will be a time, possibly a time that we will be overwhelmed. We don't want to be caught in that situation where we're going to be grappling with this ethical issue, and we're going to lose more patients or more lives this way, or even more healthcare workers. And that's a sad reality of life right now. The conversations are driven by the realization that the risk to staff amid dwindling resources of protective equipment, or PPEs, such as masks, gowns, and gloves, may be too great to justify the conventional response when a patient codes and the heart or breathing stops. And that's another issue I'll probably be talking about later on, is the lack of PPEs, masks, gowns, and gloves. And why haven't we had a national storage of these, or a national reservoir of these PPEs? These are very important questions that we need to ask. But let's go down here, and let's see what an ethicist as a bioethicist has been considering in this situation. Bioethicist Scott Halpern at the University of Pennsylvania is the author of one widely circulated model guideline being considered by many hospitals. In an interview, he said a blanket stop to resuscitations for infected patients is too draconian and may end up sacrificing a young person who is otherwise in good health, and that is very important to consider. However, healthcare workers and limited protective equipment cannot be ignored. So what do? A young person is coding, you have a universal do not resuscitate order. Are you going to risk the lives of the healthcare workers, or should we save the life of this one young person? And in that case, you save the life of one young person, why not all the other people? And these are tough questions to ask. I'm not answering it now, but it is one of those that we grapple when you work in the medical field, you work in the healthcare system. If we risk their well-being in service of one patient, we detract from the care of future patients, which is very unfair, and that is true. Happer's document calls for two physicians, one directly taking care of a patient and one who is not, to sign off on do not resuscitate orders. They must document the reason for the decision, and the family must be informed but does not have to agree. Now, what do nurses think about this? Well, we have one nurse from Michigan who made this comment. Weiss, a Michigan ICU nurse, said his own hospital has been thinking about these issues for years, but is still unprepared. They made us do all kinds of mandatory education and fittings and made it sound like they are prepared. But when it hits the fan, they do not have the supplies, so the plans they had in place aren't working. Over the weekend, Weiss said a suspected COVID-19 patient was rushed in and out and put into a negative pressure room to prevent the virus spread. In normal times, a nurse in full hazmat gear would sit with a patient to care for him, but there's little equipment to spare. So Weiss had to monitor from the outside. Before he walked inside, he would have to put on a face shield, an N95 mask, and other equipment, and slathered antibacterial foam over his bald head, as the hospital did not have any more head coverings. That's sad. Only one powered air purifying respirator, or called PAPR, was available for the room, and others nearby could be used for when performing an invasive procedure, but that was about 150 feet away, and that's more than enough for the virus to spread around. While he said his hospital's policy still called for full response to patients whose heart or breathing had stopped, he worried any efforts would be challenging, if not futile. By the time you get all gowned up and double gloved, the patient is going to be dead. We're going to be coding dead people. It is a nightmare. And this is the issue we're grappling with. As the death toll rises in the United States and the capacity to put these bodies in morgues and the medical system is strained to the point of almost breaking, how are we going to weigh one life over the many? How are we going to weigh a patient's life or the life of the healthcare workers who could care for future patients? I cannot answer that right now. And these are something that we all should be thinking about as we go through this pandemic.